Welcome everyone. My name is Dr. Monica Blied. I am a clinical psychologist in Southern California, a lupus warrior myself since 2012, and the founder of Faces of Health, which is a mental health skills training app that is free and will help you with a lot of the things that I'll talk about today. But today we're talking about caregiver wellness. So to prepare for this particular webinar today, I did a few different things. I interviewed two caregivers, one being my husband, who caretakes for me when I'm in a bad flare or have had other health conditions come up, and also someone named Chanel Matlock, who is the caregiver for a lupus warrior that you may be really familiar with, Emmett Henderson, who founded Male Lupus Warriors, and Chanel herself has lupus. So I have those interviews and I'll share their perspective. I also gathered a lot of great information from this book, and I'll share it in the chat. It's named When Someone You Love Has a Chronic Illness by Dr. Tamara Greenberg, and there are a lot of great insights. So let's start with, why is this conversation important? I think that anyone who is listening to this who has caretaken in any capacity can answer 1, 2, 3, 4, 5 reasons why this conversation is important. But for those of you who are perhaps in the patient role, or who may find yourself as a caregiver in the future, let me just share some of the research and background. Just first, starting off, life can be completely destabilized and disorienting when someone that you love has a chronic illness, and especially if that chronic illness involves chronic pain, like lupus often does. Your normal of life can be significantly altered and disrupted when you're loving someone who has a chronic illness. What past studies have shown is that people with chronically ill partners typically experience more physical symptoms and more physical and emotional distress. Physical symptoms can include a variety of different illnesses, including an increased risk for heart disease, but also the emotional and spiritual parts of it. That can include resentment, sadness, loneliness, which is something we'll talk about today, feeling helpless, feeling anger, and just the stress of it all causing sometimes insurmountable emotional strain. Seeing someone that you love who is suffering and having limited control over that. Just that experience on its own can be traumatic for many people and can be hazardous to your health if you are not taking care of yourself. So I'm going to share with you several different strategies that you can use that, again, are both grounded in the scientific literature and, from this book that I shared, and in phenomenology, which is basically like the real lived experiences of the caregivers that I interviewed for this webinar today. So number one, and I hope you're writing notes. Go ahead and grab a pen if you're not, or the notes section on your phone. Number one, acknowledge your fears and other feelings, but don't let them overtake you. Anxiety, harnessed productively, can mobilize us to change, mobilize us to help advocate for our loved one within the complex medical system and with the treatments that they need and getting the care that they need and deserve. And anxiety can also be paralyzing. It can turn on our fight or flight response, specifically with the flight or the flee, where you may want to flee from or escape from uncomfortable feelings, escape from that anxiety. And that can lead you to doing things that aren't helpful to the situation. So, for example, sharing shallow platitudes, such as, everything happens for a reason, or this illness is here to make you stronger. Like, that's not helpful. Now, if your loved one, if the patient leads with that, if the patient, grounded in their faith are saying that, then yes, follow along with them. But a lot of times, and I can say this as a person who has lived with illness, and especially the grief that comes along, that grief cycle of um, denial and anger and bargaining and all these things. Sometimes anger and crises of faith can come up. So just be super, super careful about what you share, these platitudes that you share in an effort to relieve your own anxiety, to make yourself feel better about something that can feel so out of control, so uncontrollable. You might also think that you can't imagine doing anything that would bring you pleasure while your loved one is suffering. Like, I can't imagine having an hour of self-care time because my loved one doesn't get a break from their chronic pain. They don't get a break from their illness. However, to be the most effective and optimal as a caregiver, to be able to show up for that person the way that you want to, you have to, mandatory requirement, take care of yourself, because your life satisfaction and your needs are equally as important as your loved ones, not one or the other, equally as important. But often as caregivers, there can be an identity development of like, this is who I am and this is what I do. And that can lead to neglect of yourself. And as I mentioned at the very beginning, that has dire consequences for both your physical health and your psychological health. You might also, someone might also consider that being around the loved one all the time gives them a sense of control over a situation that is largely uncontrollable. So, like, well, I can't do anything else. I can't take away their pain. I can't change the course of their illness. So, at least I can just make sure that I'm always here with them in this room or in this, hospital room. Or even feel like something bad might happen if you do step away. Again, remember, you don't have that control. Um, you leaving or you staying will not dictate or determine the course of their illness. So returning back to what else can you do to show up whole within that relationship and within your desires to caregive. So, what are some ways that you can deal with anxiety and worry specifically? If this is something that you're experiencing and some of those thoughts that I just mentioned. One, deep breathing, specifically diaphragmatic breathing. This means that you're taking a breath that exercises the diaphragm muscle that is right below your rib cage and surrounding your lungs. And that is going to help to calm down your nervous system, give you a calmer mind and a calmer body, again, so you can better show up the way that you want to, aligned with your values. So you'll take a deep breath as if you're breathing in like the best smelling chocolate cake or whatever you like, as if you're sucking in all the air in the room. Breathe in for a count of 5 with your belly going out, and then exhale fully for a count of at least 7. And as you finish exhaling, try to tighten up your stomach muscles to press out even more air, and do that for 5 times. I won't do all 5 because you've probably seen videos before showing you how to do that, but make sure that you're doing that intentionally and as often as you think about it, but at least every day. Also, write down your worries. Writing it down signals to the brain that, hey, I don't have to keep this jumbled up. I don't have to spiral because it's somewhere safe and it's somewhere that I can see. Okay, so training your brain to release that worry. And so when you're writing down, you might split your page in half where there's two columns, and you write down the things in one column that you can do something about, that you can take some action on. So scheduling the next specialist visit, or going to pick up prescriptions, things that you can actually take action on, and writing down a timeline for when you can do those things. And then the second column, write down the things that are outside of your control. The fact that your loved one has this illness, the fact that you don't know if tomorrow is going to be a good pain day or a bad pain day. Those are things outside of your control, so that you can recognize and differentiate between the two and begin to let go, or at least slowly move towards acceptance of the things that are outside of your control, while still feeling some sense of control because you're taking action on the things that you can. Remember that negative feelings for a caregiver, for all humans, but especially in your role, they're normal. This includes disappointment about what the relationship looks like, about maybe how this person has changed because of the illness, about the limitations and how they're able to help or what they're able to do, disappointment and anger. It is so crucial that you acknowledge those feelings. But here's a big but, it may or may not be helpful or useful to discuss those feelings directly with your loved one who is chronically ill and in pain. So, if that is the case, having a trusted friend, having a therapist, someone who can be a listening ear, someone who understands and can provide empathy and support, that's going to be really essential. And I'll share with you later about getting support, but then also about when it is appropriate to communicate directly how you're feeling with that loved one. Keep in mind, you can care too much. You can care to the point where it is harmful or a setback for your chronically ill loved one instead of being more helpful. The way that you do that is by prioritizing all their needs, all their concerns, because you're like a superhero with this, right? You're able to multitask, you're able to be super efficient with this. But if it's at the neglect of your own physical and psychological health, that's when you're caring too much. Okay, so don't take this the wrong way. I'm not saying like, oh, don't care about your loved one, just let them, fall at the wayside. And, that's not what I'm saying. I'm saying to have the appropriate balance so that everyone is well. Um, and again, just reminding, I can say this over and over again, optimal and effective caregiving cannot happen when you are neglecting yourself. Say if you do want to express how you're feeling, how this illness is impacting you to your loved ones, how do you do this? Be honest again, but you might say something like, I am sorry this is happening. This is awful. This illness is not fair. And you two can be sad about the illness together. You can be angry at the illness together. Um, but the anger, again, is directed towards the illness and not towards the person, reminding the person that they are loved and valued. Um, you might even say, like, I wish that I could take this away from you. Sometimes you don't know what to say, and say that I don't know what to say right now. This happens with chronically ill people. This happens when someone that you love is encountering grief. I don't know what to say right now, and I feel helpless to be able to help. Just that in your presence can be a tremendous healing power for that individual, for your loved one. And remind them again, as we said before, they're valued, but also that you care and that you're going to try to be there to help no matter what. Next, number two, get support. Okay, so I kind of like alluded to this earlier, but I want to be super specific. Caregiving can be very isolating. And in fact, studies have shown that social isolation is as strong of a risk factor for death as cigarettes, obesity, high blood pressure, and a sedentary lifestyle. As strong of a risk factor. So we want to make sure that even with the responsibilities that you have, that you're not isolated in this. So getting social support specifically is something that can buffer you against the negative physical and emotional effects of stress, including the stress from caregiving. But here are some tips for when you reach out for support. Okay. So, one, there are support groups for caregivers, but be sure that that support group is helpful and not harmful. I bring that phrase up again because there are some support groups where the dynamics between the members are unhealthy, or there's a lot of talk about death and finality, and that can make you feel more stressed and more depressed. And so, if you're feeling worse after leaving the support group than when you came in, then that's not a good fit for you. In that case, it might be better to receive support from reading about the memoirs or the testimonies of people who have been through these illnesses and on the other side, and their caretakers. Also, when you're reaching out to a friend, for example, so not necessarily a support group, but a friend for support, be sure that it's someone who is a good listener. So, a lot of people have one sided relationships. And if you didn't realize they were one sided, once you are confronting life as a caregiver, you'll start to recognize real soon, like, oh man, every time I call this person, they're just talking about them. And then when I start to talk about me, oh, they are busy or something came up and they don't have time. Like, that is a one sided relationship. One sided relationships are trash. Okay, or at least not helpful in this particular circumstance. So reach out to someone who can be a good listener, and realize that some people, it's not malicious, it's not ill intent when they are unable to be supportive. A lot of people, including the person who's chronically ill themselves, are terrified of serious illness. And so they may not be supportive, or they may say some things that are objectionable or just super not helpful unintentionally. And so that just demonstrates the limits of their capacity at that time. And that doesn't mean that you stop seeking help. So try to find that person who is a good listener. Ask specifically for what you need. So, for example, you might say, hey, I would like to talk about the caregiving that I've been providing for my partner. It feels really hard. Right now, I'm looking for just a listening ear. Right now, I'm looking for practical advice or some resources that you may know, or right now, I'm looking for someone who just gets it. Ask specifically for what you need. Do you need practical support and advice? Do you need someone who will just really be emotionally empathic? Do you need someone who will just listen and let you vent? And sometimes it's not always the same person. You know your people's personalities. You got one cousin who's like, girl, dish, what's the tea? And then you have another one who don't have time for all that. Tell me what it is. Give me the TLDR, too long didn't read, and then I'm going to help you with some strategies, right? Identify those people and first knowing what you need is going to be helpful so that you can be direct in asking for what you need and getting what you need and asking for help. Part of that help may also be getting mental health support for your chronically ill loved one, because there's such a high co-occurrence between chronic illnesses of various types and depression and poor coping. So if you find that your loved one is not coping well, not adherent to their medical regimen or using more substances, or that you find that you are using more substances or feeling more depressed, then get help, find a therapist, get that support, and stay locked in with that support. There are different support communities online specifically for caregivers. And I'm going to type that into the chat, and this will be shared online. But I'll also verbalize that. That includes netofcare.org, caring.com, and LOTSA, LOTSA, LOTSAhelpinghands.org. So let me just pop that into the chat, and Lupus LA will share that with you all. And I'll also, while I'm thinking about it, go ahead and share the book that I found very helpful for this particular topic today. Just have a few more things that I have like so much to share. And I hope that you guys find this helpful. If you do, comment, share this video with someone else. Number 3, let some things go. You do not have to be all, you do not have to do all the things. So, for example, you can use the internet to keep friends and family members updated about your loved one's health. So, the person that you're caregiving for, because sometimes it can be really taxing to have to field and manage update calls with friends and families, and you know, in addition to all the doctor's appointments and everything else that you're juggling. So in that case, you can start a blog or have an email chain, or even do a private Facebook group for those friends and family members where you post updates there. And make sure that you protect your peace. And so if you do have friends and family members of your loved one, especially if it's someone who could help you with caregiving but is not, anyone who's causing you stress, decline that phone call. Anyone that's going to provoke more stress, because again, we want to set you up for optimal functioning in this role that that you value. Something that my husband shared, Sean, he said, don't be afraid to let things slow down outside of the essentials. So when I'm very sick and he just has to take care of me, plus our little one at home, he may let laundry go for a while, just making sure that we have, like, clean underwear and clean towels as a minimum, or what he said is he'll just focus on one thing that is like clean and done well. So like, okay, we're going to focus on the kitchen counters, and then kind of just tune out everything else that's not absolutely essential. And the essentials, for him would be, going to work and earning an income. Amen. Hallelujah. And also taking care of me and taking care of the baby. Well, she's like 5, but still baby. So don't be afraid to let things slow down outside of the essentials for that temporary time frame. And also, he shared, learn the tools that work for you for coping with my lack of energy for household chores. So, part of that is like letting go of perfect. Everything doesn't have to be just so when you're in the midst of survival. Do what you can and let the rest go. Number 4, make time for me time. So throughout this whole talk, I've been talking about the values of caregiving, but also the value of still taking care of yourself, not neglecting yourself, remembering that you have to be filled and refilled in order to pour. And so what could that look like? According to Sean, early to bed, early to rise keeps you healthy, wealthy, and wise. And so I had never heard of that. I was like, I heard early to bed, early to rise. But the rationale behind that is like, if he's not getting enough sleep, he's going to be cranky and make things worse. Like, you can't match my attitude with your attitude. Like, one of us is six. You need to be calm, right? So, as a caregiver, to try to balance what's happening in the household, it'll be really important for you to make sure that you're getting enough sleep, that you're getting enough nutrition, your gut health, and that you are, Chanel Matlock shared, making sure that you are still listening to your body in the midst of caregiving. Again, balancing your needs and your partner's needs. So, for her, especially as a caregiver who is also living with her own chronic illnesses, making sure that she's tuned into, like, okay, what does my body need? Am I hydrated enough? Am I about to start flaring up and need to do extra treatments or extra self-care strategies and those sorts of things? And also staying grounded in your faith, whatever that faith may be, staying grounded in your faith, but then also your values. What is important to you? Reminding yourself of that and returning to that when the struggle gets real. Speaking of struggle, we move on to number 5. Communicate, 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 but communicate with empathy and honesty. Okay? So be honest. It is okay, acceptable. If you need permission, Dr. Blied is just giving you permission. It is okay to tell your loved one um, how you feel. Tell them that you understand that they are suffering, but when they lash out at you, it not only hurts you, but it also makes it harder for you to be supportive. You can communicate that. Try to direct your comments, your frustration, your all the feelings that come towards the illness or towards the pain. And you and your loved one that you're caregiving for can join in that frustration together. Chanel also shared, don't take offense, because she said, people who are in pain are a pain. So communicate so that it doesn't get out of control, but also don't take it personally. Something else that she shared that I thought was so profound was to learn your illness language and learn your loved one's illness language. So, you know how we have like 5 love languages? I think it's Dr. Gary Chapman talks about like physical touch and acts of service and those sorts of things. There's also illness language. So, for example, she gave the example of, okay, my partner is not eating my food. My love language is acts of service. I just cooked you this meal, right? But they're not eating. It doesn't mean that he doesn't like my food, but actually this illness has impacted his appetite. So that's the illness speaking. That's the illness communicating something that is separate from her original interpretation that could cause hurt, that could cause misunderstanding. So shifting your perspective to what else could be true in this situation. Okay, so maybe that person is not cuddling, not because they don't love you or they don't want to be around you anymore, but maybe that physical touch causes them more pain or discomfort or overstimulation at that time. Shifting your perspective. What is their illness language? Remember, not discussing your feelings, keeping it inside hurts everyone. It causes more resentment, and that's not healthy. But then also for patients with chronic pain, emotional pain can literally become physical pain. So caregivers, you all can help yourself as well as your loved one by letting your feelings be out in the open and talking through it. And this can especially be true if you're caregiving for someone where there have been past hurts in the relationship. When the time is right, addressing those hurts, and not letting them just be avoided or pushed aside, without ever being addressed. And so sometimes you guys can have that conversation on your own. Sometimes it's with the help of a therapist to help facilitate that. Number six, we're going to end at number seven, help without hurting. Sometimes when oftentimes when your loved one is living with chronic pain specifically, helping too much can hurt. So if you're just letting that person lay down and you're doing every single thing, what happens with, well, basically, the person needs to move, some sort of movement, even minimal movement can help with preventing the deconditioning of our muscles, and deconditioned muscles causes more pain. But what happens for us chronically ill people is sometimes moving hurts. And so that fight, flight, freeze response, instead of that stress response come in our brain. And when we know that, okay, when I've moved before, when I've gotten up, I feel more pain, it's going to immobilize us, it's going to freeze us to move less, but that actually hurts us more. Most doctors would agree in most conditions, not 100%, that some sort of movement is always going to help. Make sure that you talk to your physician to know what that movement is for you. Okay. Sometimes it's just stretching, sometimes it is specific physical therapies, and sometimes it's a light walk. But it is important that you as the caregiver and the patient knows what that is so that you're not hurting by taking over all responsibilities. Keep in mind that when chronically ill folks, when we feel like our bodies are attacking us, it is super important that our environment feels safe around us. Okay, that we are reminded that we are safe. And part of that safety, part of that psychological safety includes love and attachment. This makes our bodies and our minds feel safe to just be and not have another thing that we're combating and struggling against in addition to the pain and the chronic illness. Specifically, feelings of rejection can make things worse. And so, as a caregiver, if we can go back all the way to point number one about reminding them that you care, it sounds simple and it sounds like, of course, you know, because I'm doing all these things, I'm showing up for you. Of course, you know, you care. But verbalizing that you care, that they are valued in spite of and in sight of their illness, and that you're going to be there to help no matter what. It's going to make a world of difference in helping the environment feel safe. Something that Sean shared is making your spouse feel valued and loved even when they feel down. This can include a flowers or foot rub. He said that, and I was like, okay, when's the last time you gave me a foot rub? But okay, yeah, we'll share that with the audience. And then Chanel shared, read the room. So if you didn't sleep well enough and you may be cranky, maybe you need to be quiet. Or if your chronically ill loved one is kind of going off, maybe they need a moment, okay, to just cool down before you all can productively communicate. Lastly, number seven, give yourself grace and enjoy the good things. Enjoy the good days, the good things, yes, but also the good days. Enjoying the good days. When you're living with chronic illness, when you're loving someone who is living with chronic illness, when there is a good day, sometimes there can be so much anticipatory anxiety of like, okay, well, when is the other shoe going to drop? When are things going to get worse again? When are we going to be in a crisis again? And that constant fear state where we don't allow ourselves to enjoy the moment. I implore you to give yourself moments, even if it's not hours long or days long, give yourself moments to just be in the moment, to in your mind, photograph, videograph, capture this moment of, oh my goodness, my loved one is smiling. We are enjoying the beautiful weather, or we, are playing this game together, or we're just quietly watching this show and they're having a moment of relief. Allow yourself to kind of picture perfect that moment, even if it is just a moment, because that's what's going to help to build up your resilience for this very hard job that you're doing. And when your loved one is having a good day, remind them to pace themselves. We need reminders to pace ourselves because it's like, I've been feeling crappy and having low energy for all this time. Like, I can finally do something. Let me do all the things, right? And then we're like laid back on our back for several days after that because we overdid it. So, reminding the patient, your chronically ill loved one, to pace themselves, to give themselves grace, to maybe have a top three priorities for the day and just focus on the one, right? You kind of trick them like, okay, write down three things. Okay, now we're just going to do the one. And that one, we're going to split over 2 days, right? Because chronically ill people were notoriously type A personalities, notoriously overdoers. Sean shared also take advantage of the fun times when your spouse does have energy and be intentional about that, about what that day or what those moments might look like together. And finally, remind yourself, write it down on a dry erase marker in your bathroom. Have a little sticky note that is, as soon as you flip down the visor in your car, have it as a reminder that pops up on your phone. Whatever you need to do to remember and remind yourself that no one can be the perfect caregiver. You will not get it right 100% of the time. Acknowledge how difficult it is and be open to receiving support. Okay. Thank you very much. Brianna, I'm
Yeah,
open for questions.
awesome. Thank you so much, Dr. Blied. That was so helpful. I love the concept of having frustration at the illness and not the person. And that recommendation to communicate with empathy and honesty at the same time was really great. We posted your book recommendations and resources in the comments. And I also just want to let everyone listening before we dive into questions know that Lupus LA also hosts a monthly caregiver support group,
Mm.
which is both in person and online, where both family members and caregivers are welcome. You can find the details about joining that group at lupusla.org/support groups. And I also linked that in the comments below.
Awesome.
Um,
Yeah.
cool questions. These are interesting. I'm sure they can relate to a lot of people. The first one is, do you have any suggestions for making more self-care or support time without making the person with a chronic illness feel like a burden if they are in a flare?
So I can share what Sean does. He'll just take an hour. It doesn't have to be like, oh, see you later. I'll see you next week. I'm about to go on a 7-day cruise, right? And I know that's not what the person was talking about. I'm kind of just using jest, but
Sure.
it can be an hour of watching your favorite TV show, or in that, and communicating with your loved one, your chronically ill loved one, like, this time that I'm taking is going to make me better, make me more better, for being able to support you. And so I liken it to the time that I take as a mom to be better as a mom. Like, if I didn't have time for myself, like, I may end work at 4 o'clock today, for example, but then her daycare is open till 6. Sis is staying there till 6. Because, even if I'm just scrolling, it's a reset time. And so
Sure.
there are small moments like that, but then also there's also something called respite care. And so if you're living with someone who has, dementia, that's very common to have respite care where the individual would go for a weekend and you have that weekend to reset and rejuvenate. Or it's like a couple few days at a time, and so you might look into, if you do need that longer bit of time, you might look into something called respite care, or again asking for help, asking for a family member or a friend who can come so you can go and browse a bookstore for a couple hours, or go see a movie, or just sit in your car and cry,
Yeah.
because sometimes that's what we need. And scientifically, crying releases manganese, which helps our bodies to calm down and relax. And so it's a super healthy release.
Ooh, interesting.
Yeah, yeah. So there's a few different strategies for that. I hope that was
Nice.
helpful.
Yeah, no, definitely. Another question is, when should you bring up problems or feelings about a relationship issue when someone is in a flare? Wait until they're out of the flare to bring it up?
Mm,
I think you kind of touched on this where you were talking about finding a time to sit down and talk about things,
yeah,
you know.
yeah. So it really depends on the relationship.
Okay.
And so if the relationship was pretty healthy, to start with, but there was like this kind of blip or misunderstanding that happened, then that person, that chronically ill person, may feel safe in mind and body for you all to have that conversation while they're still sick.
Okay.
If the relationship was unhealthy, then having that confrontation while they're very sick could make the flare up even worse. And so you might talk to a friend or a therapist so that it's not um, holding you down, burdening you. You've vented to someone while you're waiting for them to get better, or you might kind of put a placeholder, like, I'm here to support you. I love you. There's also something that we need to talk about, but now's not the time or the place. When you get better, I want us to have a conversation, and I know it's going to be even better for us.
Very nice. Okay. Hopefully that answers that question. I thank you so much for your time, Dr. Blythe. We really, really appreciate it. Are there any just closing notes before we end our session today that you'd want to share?
Yeah, I mean, the last thing that I said was the closing note, but I'll say it
Oh,
again. There's no one can be the perfect caregiver. Give yourself so much grace. Bathe in grace and self-compassion and patience, and just keep showing up and doing your best, making sure that your best includes nurturing yourself just as much as you nurture your loved one.